Hi guys, Dr. Corbin Pominville here with Better Life. I want to give you guys this presentation. This is a presentation that I give at a lot of wellness resorts, places like that, places like Hippocrates Health Institute, to explain our treatment philosophy and how we get rid of pain permanently. So especially chronic pain is a tough one, right? So a lot of people are struggling with long-term issues. And you may have had many things thrown at you, and a lot of these treatments, the thing is that they're temporary. So things like maybe you've had heat or ice or a surgery or an injection or pain pills. Many of these treatments out there are temporary, so they don't stick. And there's a reason why they don't stick. And I'm going to explain why and kind of our treatment philosophy here and why it does work long term. So when we talk about chronic pain, the first thing that we want to differentiate between is an acute injury and a chronic injury. So what an acute injury is, it's a short-term thing, right? So you might stub your toe, you might break a bone, you might tear a muscle, something like that, injure a disc, The thing with this is most tissues in the body should heal up within 2 to 3 months. So tissue healing time is 2 to 3 months, almost all tissues. Ligaments take a little longer, sometimes discs take a little longer. But if this is not healed up within 2 to 3 months, then it becomes what we call a chronic issue, right? So it's a chronic injury, and there has to be a reason why these tissues aren't healing up. Usually, the reason is continued pressure on the area. So if there's continued pressure on the area, it can't heal up because there's always pressure on it, causing inflammation, and that inflammation makes the pain last longer. So how do we get rid of the pressure? Well, there are 2 ways that I'm going to talk about today. Basically, number 1 is myofascial release. So it's a type of deep tissue bodywork to release the soft tissue around the area that's being compressed. So sometimes with a chronic issue especially, you'll have compression around that area that's being compressed, or being around that injured area. And then the second thing is the way we're sitting, standing, walking, and exercising. So it's the way we're moving our body. AKA posture. So very important here. And the reason why is we can be putting pressure on an area without realizing it. And so I'll give an example here. So let's say, and this is something that a lot of people end up doing. So an example of standing over on one side of the body, so on one leg here. What's happening is I'm putting pressure through my knee joint, my hip joint, and my back's all twisted up. So basically that knee is grinding on itself. So is the hip. It's grinding in there. And so there's a lot of pressure through there, maybe through your labrum in your hip, or maybe through your meniscus in your knee. And the thing is, we're always going to end up going to the strong side. So if I have, let's say, an injured knee, maybe a meniscus, and I'm still putting pressure through that area. So I have an injured meniscus. I'm still putting pressure through there. The reason why is we always rely on our strong side. So even if this knee is injured, I'm still going to stand over here because that's my habit. And you'll start to realize that. It might be like this, might be like that, might be like that. But a lot of people end up sitting or standing or walking a little off. Right? So, and then what happens is this side gets tight, and then there's also compression around that area from the tightness, not just all the pressure I'm putting through, but the tightness. And then the other side gets weak, and then maybe that side starts getting injured because there's weakness and nothing's being supported over there. So that's an example of how posture and the way we sit, stand, walk, and exercise can play a big role, especially with chronic issues. So what we're going to talk about today, we're going to talk about how fascial adhesions and improper posture are a big cause of chronic pain. We're going to talk about how we're using techniques that aren't really yet used in the rehab world to fix this. And this is the combination of the deep tissue work, myofascial release, combined with posture. And how to become your most active and mobile self again. So a little background on me. I had chronic low back pain for about 5 years. I hurt myself in the gym doing a deadlift with bad form. And it did not get better until I did two things. Number one was get the connective tissue worked on, and number two was fix my daily positioning. Because here's the thing, you can be in very good shape. You can have a lot of muscle on you. You can be strong. But if you're going the other 23 hours of the day in a bad position, maybe you're sitting wrong or standing wrong or sleeping wrong, then you can have extra pressure on the area and then it won't heal up. So if there's pressure on an area, it will not heal up. So the root cause of all chronic pain. Number one, fascial adhesions. So these are a big deal when it comes to chronic injuries. So that means lasted longer than like 3 months, 2 to 3 months. If it's longer than that, if the pain's been around longer than that and it should be better by now, then the fascia likely is playing a role. So the fascia is a spider web of connective tissue that goes throughout your whole body. So it connects your muscle to your bone, to your organs, to everything is connected by this stuff. And it has a lot of pain receptors in it. So many more pain receptors than something like muscle. And so you can imagine if you have tightness in this, it can really affect you because now you have all these pain signals being sent. And so in order to allow you to move properly again, which is the real key to keeping you out of pain, is the proper movement. Many times we have to get rid of fascial adhesions first. So think of it as kind of like scar tissue. It's tightness in the connective tissue. Number two is relying on passive stability rather than active stability. So if we go back to the knee example, if I'm standing over here on one side of the body like this, and you're going to notice if you have pain a lot of times in the back or the hip or the knee, you're going to notice most likely you're over here. It's generally due to the muscles in your hips not activating properly. But if you're relying on passive stability here to hold yourself up, that's going to cause issues. Now, passive stability means anything rather than the muscles doing the work. Because basically the bones in here, so the bones, for instance, are passive stability. So if I'm just hanging out on my knee here, those bones are going to rub. When they rub, they create something that we call arthritis, right? So arthritis is just bone buildup where there is extra pressure. Now, if I had been equal and my muscles were doing the work and off-weighting the bones, then I wouldn't be relying on them, they wouldn't build up arthritis, and it wouldn't hurt. Now, the way to make arthritis feel better is to, of course, like we talked about, loosen up around the joint so it's not being compressed, become stronger and make your body used to using the things that it's supposed to when you sit, stand, walk, and exercise, to off-weight that joint. So now the bones aren't taking the pressure, they're not taking the hit. It's now the muscles doing the work like they're supposed to. Let's take ligaments, for example. If I'm sitting in the ligaments which hold the bones together, so that's what a ligament is, it holds bones together. If the ligaments in my back, if I'm sitting slumped, and the ligaments in my back are basically trying to hold me up. So they're trying to hold me up and they're going to get stretched out. And they don't like that, and that's when they hurt. Whereas if my core was doing its job to hold me in the right position, they wouldn't get stretched out back here and everything would be okay. So that's relying on passive stability rather than active stability. Big deal. Big deal. Okay. So what structure is causing your pain? When it comes to chronic issues, Number one structure is the fascia. So on the right, we have a diagram that represents the fascia. And so the fascia, like I said, it's a spider web of connective tissue, and it may be tight in one area that's affecting another area. So let's say you have a back problem. It may not be the fascia in your back that's holding your back in a tight, compressed position and causing pain. You may be tight in other areas, maybe above, maybe below, in your hips or something like that. The tightness there may be pulling the back into the wrong position. And so that's the fascia. We'll talk a little more on the next slide about that. Very important with chronic issues. Number two is the muscle. So muscles only hurt when they get tight in general, and they only get tight when they're weak. And so let's take walking, for example. So your body is going to walk no matter what. It's going to do it as much as it can. What happens is, though, if I'm walking and my glute muscles, for instance, the muscles in my butt, are not firing properly and they're not squeezing as I walk, and what happens is they basically tighten up because they're hanging on for dear life. So they're tightening up, hanging on for dear life. That tightness can cause pain or compression on other structures like nerves, things like that. Number three is the joint. So the joint will hurt when it shears or grinds. So if we talk about the knee example, if we're over here not using the muscles properly, the body doesn't know how to stand right, it can cause extra pressure. Number four is nerve. So nerves only have symptoms, and these symptoms may be numbness, weakness, tingling, neuropathy, this kind of stuff. They only have symptoms when they're being pinched. So if they're being pinched, they will have symptoms. Now, the nerve may be being pinched somewhere other than where we feel the pain or symptoms. So let's take carpal tunnel, for example. I've had many people with carpal tunnel. They come in with these symptoms in their hand, and maybe there's a surgeon who says, let's do a release right here because that's going to fix it, and it doesn't work long term. The reason why it doesn't work long term is because many, many, many times the nerve is actually being pinched up higher on its way down. The reason why is it's very hard for us to have our hand out of position. We're not usually doing that all day. It's very easy for us to have our head or our shoulders out of position. And so, and the same thing goes for the lower body. You may have something like neuropathy or drop foot or something like this. You may have symptoms in your feet or your lower leg, but it may not even be coming from there. Because it's hard to have that out of the right position, but it's easy to have something like the lower back out of the right position. So the way to get a nerve symptom better is you figure out where it's being pinched and unpinch it. And many times the deep tissue body work can make nerve symptoms feel better. The fascial work can make nerve symptoms feel better within one session. Because if you figure out where it's being pinched and you loosen that area up, it feels better. Now, to make it stick, we have to address why it was being tight. Okay, and then ligaments don't like being stretched, like we talked about. Okay, fascial restrictions and pain. So we talked about fascia quite a bit. It's a big network of connective tissue in your body, and you may have tight fascia from many different things. And this is why, and it has a lot of pain receptors, and this is why, you can have someone who has chronic pain, let's say in their back or something like that, and they can hop off the table feeling way, way, way better, much looser, way less pain, because it had a lot of pain receptors and it was holding them in a tight, compressed position. And you may have it from, different postures where you're leaning constantly onto your strong side or something like that, or maybe scar tissue from surgeries, things like that. Talking about symmetry. in the body. So if there's one thing you take away from today, it is to sit, stand, and walk equally. So we want to be sitting, standing, and walking equally. If we look at animals, like this goat here, for example, if we look at animals, they're almost all equal, almost all the time. Right? So they're not doing any sort of slumping, and they're not leaning to one side, and they're not being lazy with how they are operating. And the reason why is they use their bodies. They move, they stay strong, and they just use their muscles the way they should. They aren't lazy like us humans and grow these postural compensations and get lazy basically and get weak. So here are some examples of things to do, actionable things to do, to stop doing, that is, that will begin to start helping you feel better. Talking about the knees, the number one problem in the knees is if they fall inward. So if your knees fall inward, that can cause issues. The reason why is you have compression on one side of the joint, stretching on the other side of the joint. Neither side likes that. Now, this may be caused by either weakness in the hip or the foot. So either one of those things may not be working completely right. And so to get those knees to feel better, many times we need to make the muscles fire properly in the foot or the hip. Let's take the foot, for example. Have you heard of pronated feet or flat feet? So if the foot falls in, so the foot falls inward and you have flat feet, then what that means is the knee's going to fall in some, and so is the hip, and so is the back. It all kind of connects all the way up. And so something as simple as the foot working properly, meaning the foot muscles, can really affect everything all the way up. And this is why I always recommend, if you have kids or grandkids, what you want them to be doing is going outside and going barefoot. So barefoot kind of often, right? Because what that does is that makes us build up our foot muscles on the bottom of the foot, creating our arch. What we do nowadays as humans is we throw an orthotic in there, which just props the foot up. But what happens is if you just prop that foot up into that arch, the muscles get lazier and lazier and lazier over time, and over time it actually gets worse. And so the key is, even later on in life, making that foot work again. And this is, again, for long-term results. So proper posture. So we have 2 on the far left that will cause hip and low back pain in general. We have, and they can even cause neck or shoulder pain, and I'll give an example. So I've had multiple people, they come in. So they come in and they're standing like this. And they're trying to fix their neck, and they've been to a million people trying to fix their neck, and they're all going to the neck and trying to fix it. And they can't. And the reason why is you're not going to fix the neck because the head has to come forward if you're like this, unless you fix down here. Because if you fix down here, then the head doesn't have to come forward to balance the body weight. And so that's an example. My point there is that's an example of how full body positioning is very important. So learning to position your body correctly, very important. Now the 2 in the middle toward the right, these will cause, in general, neck and shoulder pain. So neck and shoulder pain will come from these. The one on the far right is perfect, and we don't have to get you there, but it needs to be more that way. In general, plays a big role. Okay, so what does proper posture do for you? Basically, when the bones are in the right position and the muscles hold them there, everything's stronger and it just works more efficiently. And if it works more efficiently and stronger, it keeps everything in the right position, keeps your bones in the right position, keeps everything in the right position, and then nothing gets pinched like we were talking about, and then it doesn't hurt. It's allowed to heal up. It also gives you full lung capacity. So if you're here, as opposed to here, much less lung capacity because everything's getting compressed. Okay, so for the upper body. So let's talk about upper, lower, and how to fix a couple things. So for the upper body, this is the position that everyone is in, at least for some of the day. The number one muscle that gets tight with this is your upper trapezius muscle. So if you're like this, your upper trapezius muscle can get tight. This muscle can cause neck pain, it can cause headaches, it can cause, I've had multiple people even that it cause dizziness. And to get rid of the dizziness, we had to get that to calm down. It can cause rotator cuff issues because it holds your rotator cuff in a pinched position. It's all about getting things to not be pinched. And so that can be a big issue. So if this muscle feels tight all the way through here, it feels painful, then it's probably one of the things that needs to be addressed. Your head. So the position of your head, very important. So your head weighs about 12 pounds. So if you imagine holding a bowling ball here as opposed to here, much heavier out in front of you, right? So just according to this graph, just 2 inches forward, we're almost 3 times the amount of pressure on everything in there. So this is on your bones, on your discs, on your ligaments. Everything in there is going to have more pressure. In the neck, we have a nerve coming out of every level of the spine. Now, if your head is forward, the holes where the nerves come out of get smaller. So biomechanically, if your head is forward, those holes get smaller. What that can cause is it can cause the nerves can get pinched, and then you may feel neck pain. You may feel like symptoms in your arm or hand, maybe pain or weakness or numbness, things like that. Carpal tunnel may be coming from the position of your head. Now, we can get away with this in general when we're 20 and we don't feel nerve symptoms from the head forward. We might feel muscular stuff, but not nerve stuff. But over age 40 or 50, when we have arthritis in there, which remember is just bone buildup, over age 40 or 50, if you already have those holes being smaller and then you make them smaller by having your head forward, now things get pinched. So for the upper body, very important. So this is the basics of posture. We want the shoulders to be back and down, and we want the chin to be tucked back. So shoulders back and down and chin tucked back. For the lower body, the number one thing that will cause an issue in hip and lower back areas is too much of a curve in the lower back. The reason why is same thing, especially over age 50, and same reason as in the neck. So we have nerves that come out of the spine. These nerves can get pinched if you're in too much of an arch. If they get pinched, because again, the holes get smaller if you're in more of an arch. So more of this, the holes get smaller. And so what that can result in is back pain. It can result in drop foot. It can result in weakness in the legs. It can result in sciatica. It can result in neuropathy sometimes. Many, many, many things can be caused simply by too much of a arch in the lower back. Now, what causes that? Primarily is sitting. So basically when we sit, the muscles on the front of our legs, so when I'm sitting here, the muscles on the front of my legs, which basically go from here to here, are in a shortened position. And so then they get tight in that shortened position. I go to stand up, and they hold me that way. So I'm in more of an arch. And so sitting, this is why sitting is such a bad thing to do so much, and we all do it way too much, because it makes us go into that position where the back's getting compressed. Now the front of the hip's getting compressed because of that position, the knees even, everything is getting compressed. Okay. So this is why for ergonomics sitting, you want to make sure, the number one thing to remember is to keep your hips just above your knees. So hips just above the knees. And what that does is that makes it so it's less shortened in the muscle here, the hip flexor. Talking about imaging for chronic issues. So imaging can be very helpful for short-term things. For long-term issues, many times it can show things that are not actually causing your pain. So this is why I have some studies here to show you. So a bunch of people in these studies. This is someone like me, no pain, walking in. They take an image of my body and they say, this is what we see. So if we look at the knee, 61% of people will have a meniscus tear in the knee. This is people with no knee pain. If we look at the hip, 69% of people will have a labrum tear in their hip. People with no hip pain. If we look at the neck, 87% of people have a bulging disc in their neck. And so now you go in with neck pain and they take an image of your neck and they say, this is what we see. We see this bulging disc. Let's do some cortisone in there. That has to be what's causing your issue. But it's usually not. That disc probably has been herniated for, bulging for years. And what the imaging doesn't show is it doesn't show tight fascia, doesn't show tight muscles, doesn't show things that are getting compressed a lot of times. There's many, many different things. It doesn't show your positioning your body, where there might be pressure on that area all day long. It only shows the structure. So that's the problem with imaging for chronic pain. We just have to be wary of it. We might want to use it to confirm what's going on. The best way to do it is we work backwards. We test your muscles. We see what's tight. We see what's weak. We work on you and we figure out what's going on, and then we work backwards to figure out what structure is actually causing the issue. If you look at lower backs, this is asymptomatic lower backs, no pain. Everything in here is going to have some issues. So the keys to fixing pain. Number 1 is fascial and scar tissue release. This is for chronic pain. Number 2 is proper positioning. So the body needs to be positioned properly. This goes for everything in there. We may need mobility in something like the connective tissue or the bones. We may need postural awareness, and we may need strength to keep you there. So it's a process. It's simple, but it's not easy. And maybe some injury-specific exercise depending on which structure is injured. So in conclusion, fascial adhesions and improper posture are a huge cause of chronic pain. Myofascial release is very effective to start to get people out of this. Because many times what happens is people who have been in pain for a long time can't move the way they used to. So they used to be able to move a lot. Now they've been in pain for so long they can't move much. What this body work does is it allows you to move more easily, and then that movement allows us to get you stronger in the right position and stay there. Anyone can become their most active and mobile self again. A final piece of advice: 95% of orthopedic surgeries can be prevented. Once in a while you'll have something that can't, but almost always they can be prevented. Even things that they say, it's bone on bone, or there's a ton of arthritis, or you have a bulging disc. Many, many, many of these things can be fixed without surgeries. Find yourself a quality PT, address your fascial restrictions, and fix your posture, get strong. If you can fix the way you move, you can fix pain. And no injury is too old. So remember, if you come see us, make sure you tell us everything, because here we can address the whole body, and we need to in order to fix chronic pain. We've had people here who come in. So for instance, I'll tell you a story, an example of a patient who came in. She comes in, she's like, hey, I just want to fix my posture. We're like, okay. So we get started, and halfway through the session I realize she's not moving her arm. Her arm's just here. I'm like, what's going on with the arm? And she says, oh, that old thing, I wrote that off a long time ago. That thing hasn't worked in 4 years. And so I started working on it, and what we found was it was just the rotator cuff getting pinched by a tight muscle. And so by the end of the session, she was about up to here, just from one treatment, right? And that's just an example. It happens many, many times. You can have another story. I had a guy come in to me who he was kind of stuck here, and he wanted to get upright, and he had a lot of pain in his mid-back region. And so we were working on that. He was getting better, and then he after a few sessions he starts mentioning, oh, you know what, by the way, I haven't been able to walk further than just a few minutes for about 20 years. I'm like, excuse me? That's something you should have told me at the very beginning. And the reason why was he was having a lot of pain in his calves, both of them. So we started working through some of the connective tissue down there, and even within 5-6 weeks, he was walking just like a few miles at a time. So no injury is too old. Make sure you tell us everything, because that is what we're good at here. What an appointment looks like. You tell us the whole story, and then we start working on you to see if we can help. And we're not going to work with you if we can't help you. So it's, we just want to see if we actually can help you. Because chronic injuries are complex. So we need to do a full assessment to make sure we can help you. Half us working on you, half us teaching you how to position and move your body correctly. That's kind of what the treatments look like. And the end result is fast, natural, and long-lasting pain relief. Any questions, please reach out. I'm Dr. Corbin Pominville with Better Life. Thank you. Hope you learned a lot.